Question 1. In the context of positron emission tomography (PET), the annihilation process plays a crucial role in image formation. Mr. Taylor is working on understanding how positron emission leads to photon creation. He's examining the collision of a positron with an electron, which results in the release of two 511 keV photons. What is the significance of the 511 keV photon pair in PET imaging? A. They provide essential information for accurate attenuation correction. B. They are used to calculate the radiopharmaceuticals biodistribution. C. They form the basis of coincidence detection in PET scanners. D. They determine the patient's metabolic rate. Answer. Correct answer. C. Explanation. In PET imaging, positron emission results in the annihilation of the positron and an electron, producing two 511 keV photons that travel in opposite directions. These photons are detected by the PET scanner's detectors. The simultaneous detection of both photons in a coincidence event is crucial for determining the location of the annihilation event, forming the basis of the PET image reconstruction processes. A fundamental aspect of coincidence detection, which enables PET scanners to localize and visualize the distribution of radiopharmaceuticals within the body. Option A refers to attenuation correction but does not directly relate to annihilation photons. Option B and D are related to other imaging processes, not the annihilation process. Question 2. Mr. Lee is analyzing the spatial resolution of a PET scanner. He notices that the spatial resolution can be influenced by several factors. Which of the following is the most significant factor affecting spatial resolution in PET imaging? A. The type of radiopharmaceutical used. B. The number of coincidence events detected. C. The size of the detector elements and the geometry of the scanner. D. The patient's body mass in BMI. Answer. Correct answer. C. Explanation. Spatial resolution in PET imaging refers to the ability of the system to distinguish between 2 points in the body. The most significant factor affecting spatial resolution is the size of the detector elements and the geometry of the scanner. Smaller detector elements and optimal scanner geometry lead to better spatial resolution because they allow for more precise localization of the annihilation events. Option A is incorrect, as radiopharmaceuticals mainly affect the biodistribution and image contrast but not spatial resolution. Option B relates to signal detection but is not the dominant factor for resolution. Option D may influence PET image quality in certain cases but does not directly impact spatial resolution. Question 3. According to recent studies, the PET integration offers several diagnostic advantages. Mrs. Richards, a patient undergoing cancer staging, has just completed both PET and CT scans. What is the primary clinical advantage of combining PET with CT? A. PET provides better anatomical detail than CT. B. CT helps improve the accuracy of attenuation correction in PET. C. PET allows for fast scanning times than CT. D. CT provides better information on metabolic activity than PET. Answer. Correct answer. B. Explanation. The combination of PET and CT in PET scanners primarily enhances the accuracy of attenuation correction in PET images. CT scans provide detailed anatomical images that help identify the patient's internal structures and tissues, which are essential for accurately correcting the attenuation of the PET signal. This correction ensures that the PET images reflect true radiopharmaceutical uptake in the tissues in diagnostic accuracy. Option A is incorrect, as CT provides better anatomical detail, not PET. Option C is not accurate. PET scans often take longer than CT scans. Option D is incorrect because PET is the modality that provides metabolic activity information, not CT. Question 4. What is the primary function of time-of-flight TOF technology in PET imaging? A. To increase the signal-to-noise ratio. B. To improve the spatial resolution by reducing scatter. C. To reduce the radiation dose to the patient. D. To accurately localize the annihilation event by measuring the time difference between the detection of the two photons. Answer. Correct answer. D. Explanation. Time-of-flight TOF PET technology improves the accuracy of image reconstruction by measuring the time difference between the detection of the two annihilation photons. This additional time measurement allows the PET scanner to more precisely localize the point of the annihilation event, resulting in improved image quality, particularly in high-noise environments. The accuracy of TOF leads to enhanced spatial resolution and sensitivity, especially in cases where signal strength is low. Option A refers to signal-to-noise ratio, which TOF indirectly impacts, but it's not its primary function. Option B is more related to scatter correction techniques. Option C does not directly apply to TOF technology. Question 5. During the process of PET imaging, motion correction is a crucial step. Mr. James, undergoing a cardiac PET scan, is unable to remain still due to discomfort. What is the most effective motion correction technique for improving image accuracy in this scenario? A. Increase the dose of radiopharmaceutical to compensate for lost data. B. Apply motion correction algorithms during image reconstruction. C. Use a higher resolution scanner to compensate for motion artifacts. D. Perform the scanner a lower energy level to reduce motion effects. Answer. Correct answer B. Explanation. Motion correction techniques, such as the use of advanced algorithms during image reconstruction, are the most effective way to correct for patient movement during PET imaging. These algorithms can adjust for the blurring or displacement caused by motion, providing a more accurate representation of the metabolic activity within the body. Increasing the radiopharmaceutical dose. Option A would not correct motion artifact and could increase patient exposure to radiation. Using a higher resolution scanner. Option C would not necessarily compensate for motion and lowering the energy level. Option D could compromise image quality without addressing the motion itself. Question 6. To determine the effectiveness of a radiopharmaceutical in PET imaging, it is essential to evaluate its biodistribution. Mr. Chang is studying the biodistribution of a new radiopharmaceutical. Which of the following factors is most likely to influence the biodistribution of a PET radiopharmaceutical? A. The energy level of the emitted photons. B. The chemical properties of the radiopharmaceutical. C. The body mass index (BMI) of the patient. D. The scanner's spatial resolution. Answer. Correct answer B. Explanation. The chemical properties of a PET radiopharmaceutical, such as its lipophilicity charge and molecular size, play a significant role in determining its biodistribution. These properties influence how the radiopharmaceutical travels through the body, its uptake in different tissues, and its clearance. Option A refers to photon characteristics, which are important for image acquisition but not directly for biodistribution. Option C may affect how the radiopharmaceutical is distributed, but the primary factor is the chemical properties. Option D affects image resolution but does not influence biodistribution. Question 7. In light of recent developments in radiation protection, which of the following is a recommended practice to minimize radiation exposure during PET imaging? A. Use the maximum feasible dose of radiopharmaceuticals to ensure clear images. B. Limit the number of PET scans a patient receives during a given period. C. Decrease the distance between the scanner and the patient to improve image quality. D. Provide shielding to reduce radiation exposure to surrounding tissues. Answer. Correct answer D. Explanation. Providing shielding to reduce radiation exposure to surrounding tissues is a key practice in radiation protection. Shielding helps minimize unnecessary radiation exposure to areas of the body that are not the target of the imaging. Limiting the number of PET scans. Option B is also important but is a less direct method for reducing exposure in each individual scan. Option A contradicts the ALARA as low as reasonably achievable principle, which aims to minimize exposure, not maximize it. Option C would actually increase exposure to surrounding tissues and is not recommended. Question 8. Mrs. Walker is being scanned using a PETMA scanner for neurological evaluation. One of the advantages of PETMA over PECT is related to soft tissue contrast. What is the primary reason for this advantage in PETMA imaging? A. Mr. provides superior resolution of bone structures. B. Mr. has a higher sensitivity to metabolic activity than PET. C. Mr. offers superior soft tissue contrast without ionizing radiation. D. PET provides better anatomical detail than ISTA. Answer. Correct answer C. Explanation. The primary advantage of PETMA over PECT is that MR offers superior soft tissue contrast, allowing for better delineation of soft tissues such as the brain, muscles, and organs. This high soft tissue contrast is achieved without the use of ionizing radiation, which is an advantage over CT. PET provides metabolic activity information, but missed superior soft tissue contrast enhances the precision of PET images, especially in neurological imaging. Option A is incorrect as CT, not MR, is better for imaging bone structures. Option B is not accurate because PET detects metabolic activity, not ISTA. Option D is incorrect because PET does not provide better anatomical detail than ISTA. Question 9. Based on the information from a recent study on radiolabeling, which factor is most important when selecting a radiolabeling method for a PET radiopharmaceutical? A. The cost of the radiolabeling process. B. The availability of cyclotron-produced isotopes. C. The stability of the radiopharmaceutical after labeling. D. The type of PET scanner used. Answer. Correct answer C. Explanation. The stability of the radiopharmaceutical after labeling is a crucial factor in selecting a radiolabeling method. A stable radiopharmaceutical ensures that the tracer maintains its integrity during imaging, leading to accurate and reliable results. Option A is a practical consideration but is not the most critical factor for successful radiolabeling. Option B may affect radionuclide availability but not the fundamental radiolabeling process. Option D is irrelevant because the radiolabeling process must be stable regardless of the scanner type. Question 10. When considering PET scanner calibration, ISTA Patel is evaluating the normalization procedure. What is the primary goal of normalization in PET imaging? A. To correct for variation in detector response and ensure uniform image quality. B. To calibrate the scanner for different radiopharmaceuticals. C. To improve the spatial resolution of the scanner. D. To adjust the scanner's sensitivity for different patient sizes. Answer. Correct answer A. Explanation. Normalization in PET imaging is used to correct for variations in detector response, ensuring that all detectors contribute equally to the final image. This procedure helps produce uniform image quality across the entire field of view, eliminating artifacts caused by differences in detector efficiency or performance. Option B is incorrect because normalization does not specifically calibrate for different radiopharmaceuticals. Option C relates to spatial resolution but is not the primary goal of normalization. Option D is incorrect because normalization does not adjust for patient size directly. Question 11. In a context of PET imaging, consider a scenario where Dr. Taylor is reviewing an FDG PET scan for a patient with suspected lung cancer. The PET scan reveals an area of increased metabolic activity in the right lung. The radiologist asks Dr. Taylor if this is indicative of malignancy. What should Dr. Taylor take into account when interpreting the findings? A. The metabolic activity observed is a clear indicator of malignancy. B. Increased metabolic activity may be due to inflammation or infection and requires correlation with clinical data. E. FDG PET scans are diagnostic on their own and do not require further clinical input. D. Only the size of the lesion can confirm whether the increased metabolic activity is malignant. Answer. Correct answer B. Explanation. Increased FDG uptick is often seen in both malignant and benign processes, including inflammation and infection. It is essential to correlate PET findings with the patient's clinical history, histopathology, and other imaging modalities. E.g., CT or MRI. Malignancy is confirmed only through biopsy or clinical follow-up. This principle aligns with the importance of multimodal imaging in clinical diagnostics. Question 12. Which of the following factors most significantly impacts the spatial resolution of a PET scanner? A. The energy of the photons detected. B. The size of the scintillator crystals. C. The length of the detector rings. D. The thickness of the attenuation correction material. Answer. Correct answer B. Explanation. Spatial resolution in PET is primarily influenced by the size of the scintillator crystals and their ability to capture photon events with minimal scattering. Smaller crystals generally improve resolution as they allow for better localization of photon interactions. This is in contrast to factors like photon energy or attenuation material thickness, which influence other aspects of image quality but not direct facial resolution. Question 13. Considering the latest advancements in PET, Dr. Hernandez is exploring the use of amyloid tracers in diagnosing Alzheimer's disease. What key factor must be considered when interpreting PET images using these tracers? A. Amyloid PET scans can detect early-stage disease even before clinical symptoms arise. B. The presence of amyloid plaques guarantees a diagnosis of Alzheimer's disease. C. Amyloid PET scans are most effective for diagnosing other forms of dementia, not Alzheimer's. D. The presence of amyloid plaques on PET is unrelated to clinical symptoms of Alzheimer's. Answer. Correct answer. Explanation. Amyloid PET tracers are used to detect the presence of amyloid plaques in the brain, which is a hallmark of Alzheimer's disease. The key to interpreting amyloid PET images is recognizing that these plaques can be present in the brain even before cognitive decline occurs, allowing for early detection of the disease. However, the mere presence of amyloid does not necessarily correlate directly with symptoms or confirm or diagnose Alzheimer's. Question 14. In the process of quality control for PET imaging, what would be the most appropriate action to ensure that the scanner's performance meets regulatory standards? A. Perform weekly calibration and ensure that the system's spatial resolution remains within the required range. B. Only focus on checking the consistency of radiopharmaceutical delivery without considering scanner calibration. C. Perform daily tests on patient doses to ensure regulatory compliance. D. Quality control is not needed if the scanner appears to be functioning normally. Answer. Correct answer. A. Explanation. Regular quality control UC procedures are crucial to maintaining the integrity of PET imaging systems. This includes daily, weekly, and monthly checks, including calibration and verification of spatial resolution. These checks ensure that the scanner's performance is consistent and meets regulatory requirements. Regulatory bodies like the FDA and NRC mandate such UC procedures to guarantee safety and imaging accuracy. Question 15. Dr. Wilson is conducting a PET scan for a pediatric patient. What specific consideration should be given to minimize the radiation dose in this scenario? A. Use higher activity levels to ensure accurate imaging in pediatric patients. B. Avoid using PET scans for pediatric patients due to high radiation exposure risks. C. Adjust the radiopharmaceutical dose based on the child's weight to minimize exposure. D. PET scans are equally safe for all age groups, regardless of weight or size. Answer. Correct answer. C. Explanation. Pediatric patients are more sensitive to radiation, and minimizing their exposure is crucial. Dose adjustment based on the child's weight is an essential practice to ensure that the radiation dose is as low as possible while still achieving diagnostic quality images. Guidelines from organizations like the American College of Radiology (ACA) emphasize the importance of dose optimization, particularly in sensitive populations like children. Question 16. A PET scan reveals a hotspot in the myocardial region, and the clinical team is considering performing a myocardial viability study. What is the primary radiopharmaceutical used for assessing myocardial viability in PET imaging? A. FDG fluorodeoxyglucose. B. Ammonia 13. C. Sodium fluoride 18. D. Choline 11. Answer. Correct answer. B. Explanation. Nitrogen 13 ammonia. 13 ammonia is commonly used in myocardial perfusion imaging to assess myocardial viability. This radiopharmaceutical provides a direct measure of regional myocardial blood flow and is essential for evaluating patients with coronary artery disease and assessing the viability of myocardial tissue. F to G is more useful for detecting metabolic activity in tumors, inflammatory conditions, while sodium fluoride 18 is typically used for bone imaging. Question 17. Dr. Martinez is assessing the integration of PET and CT scanners. What is the primary advantage of this integration in clinical practice? A. The ability to perform high-resolution CT scans without any additional radiation exposure. B. The ability to combine functional PET imaging with anatomical CT information, improving diagnostic accuracy. C. CT is used only for attenuation correction in PET with no other clinical benefits. D. PET and CT cannot be integrated. Each modality must be used separately for optimal results. Answer. Correct answer, B. Explanation. The integration of PET and CT allows for the combination of functional imaging PET with high-resolution anatomical images CT, significantly improving diagnostic accuracy. This fusion enables precise localization of abnormalities such as tumors and allows for better delineation of the tissue type and pathology. Additionally, CT helps with attenuation correction, which is critical for accurate PET interpretation. Question 18. Dr. Lee is performing a PETMA scan. What is the main advantage of PETMA over traditional PET? A. Mr. provides better bone imaging than CT, making it more suitable for oncology. B. PETMA has superior soft tissue contrast, which is particularly useful for brain and abdominal imaging. C. PETMA allows for faster imaging due to the combined use of both modalities. D. PETMA can use lower doses of radiopharmaceuticals compared to PET. Answer. Correct answer, B. Explanation. PETMA imaging combines the functional benefits of PET with the superior soft tissue contrast of MRI. This combination is particularly beneficial for imaging in areas like the brain, liver, and soft tissues where CT might not provide the same level of detail. The ability to perform detailed soft tissue imaging alongside PET's functional data leads to more precise diagnostics, especially in oncology. Urology. Question 19. Dr. Roberts is evaluating the pharmacokinetics of a new radiopharmaceutical used for brain imaging. Which of the following factors is most critical when interpreting the pharmacokinetic data? A. The half-life of the radiopharmaceutical. B. The patient's weight. C. The radiopharmaceutical's biodistribution and clearance. D. The dose of the radiopharmaceutical used. Answer. Correct answer, C. Explanation. When evaluating the pharmacokinetics of a radiopharmaceutical, it is critical to understand its biodistribution and clearance patterns. These factors determine how the compound is absorbed, distributed, metabolized, and eliminated in the body, which directly impacts image quality and diagnostic accuracy. Understanding these pharmacokinetic properties is key for accurate data interpretation and for optimizing clinical applications. Question 20. During a PET scan, motion artifacts are detected in the image. What is the best way to address this issue to improve image quality? A. Increase the patient's radiopharmaceutical dose to reduce motion artifacts. B. Perform the scan in different positions to prevent motion during imaging. C. Use motion correction techniques to adjust for patient movement during the scan. D. Decrease the time of the scan to minimize the effect of motion. Answer. Correct answer, C. Explanation. Motion artifacts can degrade image quality in PET scans. The best solution is to use motion correction techniques which are designed to adjust for patient movement during the scan. These techniques can significantly improve the quality of the final image, while repositioning the patient or shortening the scan time may help reduce motion. Motion correction algorithms are specifically designed to address this issue with compromising diagnostic integrity. Question 21. In the context of PET imaging, Dr. Adams is preparing a scan for a patient with suspected lung cancer. The patient has a history of COPT, which could result in varying attenuation. What correction method should Dr. Adams use to ensure the PET scan is accurate and reflects true metabolic activity? A. Scatter correction. B. Attenuation correction using transmission scans. C. Attenuation correction using CT data. D. Motion correction. Answer. Correct answer, C. Attenuation correction using CT data. Explanation. Attenuation correction is critical for accurate PET imaging, especially when there are variations in tissue density like in patients with COPT. CT-based attenuation correction is the most reliable method as it provides detailed anatomical data that compensates for attenuation differences, improving image quality. This is particularly effective in PET imaging. CT scan provides the necessary data for attenuation correction, ensuring accurate metabolic readings. Scatter correction primarily addresses photon scatter, and motion correction adjusts for patient movement during the scan. Question 22. Given the circumstances of using FDG PET in oncology, a patient with colorectal cancer is being evaluated for metastases. The imaging team needs to assess the tumor's metabolic activity and detect any early metastases. What will be the primary clinical advantage of using F-G in this case? A. F-G shows excellent contrast in soft tissue imaging. B. F-G is specifically sensitive to cancer cell metabolic activity. C. F-G has no radiation burden to the patient. D. F-G can detect early-stage brain tumors more effectively. Answer. Correct answer. B. F-G is specifically sensitive to cancer cell metabolic activity. Explanation. F-G, fluorodeoxyglucose, is a radiopharmaceutical widely used in oncology, especially for detecting metabolic activity in cancer cells. Cancer cells tend to have increased glucose metabolism, making F-G PET highly effective for identifying malignancies, staging cancer, and monitoring treatment response. F-G is not used for detecting early-stage brain tumors specifically. It also carries a radiation burden, but this is acceptable in oncology for the benefits it provides in identifying active tumors. Question 23. Mr. Davis is undergoing a PET scan for neurological evaluation of a suspected early-stage Alzheimer's disease diagnosis. Considering the characteristics of MRI, what is the primary benefit of combining MRI with PET in his case? A. MRI offers better soft tissue contrast and anatomical details, which complements PET's functional data. B. MRI provides higher resolution of metabolic data than PET alone. C. PET-MR offers better resolution of bone structures than PET. D. MRI reduces the radiation dose associated with the PET scan. Answer. Correct answer. A. MRI offers better soft tissue contrast and anatomical details, which complements PET's functional data. Explanation. The primary advantage of PET-MR is the combination of PET's ability to assess metabolic activity with MRI's superior soft tissue contrast. This pairing allows for precise localization of abnormalities, especially in neurological conditions like Alzheimer's disease. MRI provides detailed anatomical image, while PET detects functional changes, thus enhancing diagnostic accuracy. PET-MR doesn't reduce radiation dose, and MRI does not directly improve PET's metabolic data resolution. Question 24. In a study analyzing the pharmacokinetics of a new PET radiopharmaceutical, the team focuses on the radiopharmaceutical's uptake and elimination kinetics. What is the most important factor to consider in this analysis? A. The half-life of the radiopharmaceutical. B. The method of synthesis of the radiopharmaceutical. C. The patient's body mass index (BMI). D. The biodistribution of the radiopharmaceutical in various tissues. Answer. Correct answer. D. The biodistribution of the radiopharmaceutical in various tissues. Explanation. Biodistribution refers to the pattern in which the radiopharmaceutical spreads throughout the body, which is crucial in understanding how the substance behaves within different tissues. This data helps assess the pharmacokinetics, including uptake and elimination rates. The half-life and synthesis method are important, but biodistribution provides them relevant information about the substance's clinical utility and its effectiveness for diagnostic purposes. Question 25. Dr. Wallace is reviewing a PET scan of a patient with myocardial ischemia. The PET scan has shown reduced myocardial blood flow. What additional imaging modality should Dr. Wallace consider to complement the PET scan results? A. An X-ray to examine coronary artery calcification. B. A coronary CT angiogram to assess coronary artery blockage. C. An MRI to assess soft tissue damage. D. A skeletal muscle scan to evaluate ischemia effects. Answer. Correct answer. B. A coronary CT angiogram to assess coronary artery blockage. Explanation. In cases of myocardial ischemia, the PET scan can show areas with reduced blood flow, but a coronary CT angiogram would be ideal for visualizing the actual structural blockages in coronary arteries. PET is excellent for assessing blood flow and metabolic activity, but CT angiography offers direct visualization of blockage, narrowing in the coronary vessels, providing a comprehensive diagnostic approach for ischemic heart disease. Question 26. Considering the design of modern PET scanners, what is the primary function of the photomultiplier tubes PMTS and a PET scanner? A. To detect the positron emission and initiate the annihilation process. B. To amplify light signals produced by the scintillators. C. To generate CT images that align with the PET data. D. To correct for motion during the scan. Answer. Correct answer. B. To amplify light signals produced by the scintillators. Explanation. Photomultiplier tubes (PMTS) are crucial components of PET scanners. Their primary function is to amplify the light signals generated by the scintillators when they interact with gamma photons. These light signals are then converted into electrical signals for further processing. The PMTS do not initiate the annihilation process or generate images. Motion correction is typically handled by other techniques, such as gating or software-based adjustments. Question 27. Which of the following scatter correction techniques is most commonly used in PET scans to improve image quality by reducing noise caused by scattered photons? A. Dual-entity CT scanning. B. Time-of-flight TOF imaging. C. Energy windowing. D. Fourier transform filtering. Answer. Correct answer. C. Energy windowing. Explanation. Energy windowing is a scatter correction technique that is widely used in PET scans to minimize the effects of scattered photons. It involves selecting photons within a narrow energy window around the expected energy of the annihilation photons to exclude scattered ones. This helps to reduce noise and improve the overall image quality. Dual-entity CT is used for attenuation correction, TOF. Facial resolution and Fourier transforms are used for image reconstruction, but not specifically for scatter correction. Question 20. Dr. Harper is conducting quality assurance testing on a PET scanner. He is particularly concerned about ensuring the spatial resolution of the system is optimal. Which of the following would be the most effective way to test spatial resolution? A. Using a point source phantom to evaluate resolution at different distances. B. Checking the consistency of the detector's energy calibration. C. Performing daily scanner calibration using radioactive isotope. D. Measuring the time to peak (TTP) in static phantom. Answer. Correct answer. A. Using a point source phantom to evaluate resolution at different distances. Explanation. The most effective method to test spatial resolution is by using a point source phantom. This phantom allows for testing how well the scanner can distinguish between two closely spaced points, which is critical for assessing spatial resolution. While calibration and energy consistency are important, they are not direct tests for spatial resolution. Times to peak measurements are related to the timing accuracy of the scanner, not spatial resolution. Question 29. Mr. Lee is being considered for a PET scan to monitor his treatment response for a brain tumor. Which factor most significantly affects the accuracy of the PET scan in this scenario? A. The patient's body temperature during the scan. B. The timing of the radiopharmaceutical injection relative to the scan. C. The thickness of the patient's skull. D. The presence of dental fillings. Answer. Correct answer. B. The timing of the radiopharmaceutical injection relative to the scan. Explanation. The timing of radiopharmaceutical injection is a crucial factor in PET imaging. For accurate metabolic imaging, it is important to inject the radiopharmaceutical FDG and allow sufficient time for it to distribute and accumulate in the tissues, including the tumor. Too early or too late. A scan can result in misleading results. Body temperature and dental fillings are not significant factors, and while skull thickness can affect image resolution, it is less critical in determining accuracy. Question 30. In light of recent developments in radiopharmaceuticals, a new PET tracer is being tested for assessing amyloid plaques in Alzheimer's disease patients. What key factors should be considered when evaluating this new radiopharmaceutical for clinical use? A. Its ability to provide high contrast for soft tissue visualization. B. Its half-life and safety profile in terms of radiation dose to the patient. C. Its ability to bind specifically to amyloid plaques only in healthy patients. D. Its compatibility with MRI imaging protocols. Answer. Correct answer. B. Its half-life and safety profile in terms of radiation dose to the patient. Explanation. When evaluating a new PET tracer, the half-life and radiation safety profile are critical, especially for clinical applications. The half-life must be long enough to allow for effective imaging while minimizing radiation exposure to the patient. The safety profile ensures that the dose does not exceed regulatory limits for radiation exposure. While contrast for soft tissue is important for image quality, the primary concern in a clinical setting is patient safety, particularly with new tracers.